Here's the headline. New York Times, Sunday Review, big, bottom of the page. Sunday, August 7th, this last week. I hope you have a copy of it. It says, cancer drugs effective but scarce. Let me just read this. I'm not going to comment. Just listen to this. It says, right now, cancer care is being rationed in the United States. It is caused by a severe shortage of important cancer drugs. Of the 34 generic cancer drugs on the market as of this month, 14 were in short supply. They include drugs that are the mainstay of treatment regimens used to cure leukemia, lymphoma, and testicular cancer. Quote, if you are a pediatric oncologist, you know how to cure 70 to 80% of patients. But without these drugs, you are out of business. It continues, there are plenty of newer drugs that do not cure anything, but just extend the life for a few months at cost up to $90,000 a year per patient. Only the older, these curative drugs that we know work, drugs that can cost as little as $3 a day, have become unavailable. It continues, most of these drugs have no substitutes, but crazy as it seems, in some cases, these shortages are forcing doctors to use drugs that are 100 times the cost and are not anywhere as effective. Only about 10% of the shortages can be attributed to lack of raw materials and ingredients. Listen to this. Most shortages appear instead to be the consequence of corporate decisions to cease production or interruptions in production caused by money, which manufacturers do not appear to be in a rush to fix. So this is the most startling thing I've read and I shouldn't be surprised. But what they're saying is we have drugs that we know are curative in certain forms of cancer that are not being produced or being dramatically reduced in their production because they're not making enough money. They would rather sell a drug that costs $90,000 a year that gives a person a little bit more lifetime but is not curative. How can you even think about, how could you be in an industry that I just cannot comprehend that? Can somebody explain this to me that has rational thinking around this? If I had a family member or me that had cancer and I knew there was a drug out there that was a darn effective drug at possibly keeping me alive, and I'm told, well, the drug companies don't make that anymore because it was not very profitable for us, but I got this new drug, give you another month.